Welcome to the fourth module. So this is going to be talking about vital signs and when you would want to call 911 and escalate it and get some emergency help. So what you're going to be looking at are different vital signs that the baby has. So these include breathing rate, pulse rate, the skin, their general sense of awareness. So what we're going to do is we're going to show you what are kind of the thresholds for where you want to be concerned and where it's, you kind of just want to monitor the baby and let them work through it themselves so that they can build their own immune system and their own resistance to whatever's troubling them. But there are levels where once it goes past a certain level, that's going to trigger us to want to call 911 because things can escalate quickly when we're talking about fever or breathing rate. And there are zones that we can look at so that we can make that decision from an educated and a wise perspective. So thanks again for being here through all these modules. After the quiz in this section, you're finished, that's it. You'll have completed the course and you'll be one step closer or further along and being able to be a great nanny or caregiver or parent. So thanks again for being here. We appreciate everybody's efforts in trying to pull together and provide the best care we can to these little ones. They definitely deserve our best and we appreciate you. Thank you.
Okay, so when to call 911. So you're taking care of a baby and they're not normal. Something is unusual, something's off. Your instinct has you worried, so you're checking it out. And when do you take the baby to the doctor? When do you go to the hospital? When do you call 911? Well, the answer is when in doubt, check it out. Anytime you're unsure, always err on the side of caution when it comes to contacting emergency help with 911 or the doctors or something like that. It is never a bad idea to be the squeaky wheel and find out. So that's what we want to say at the beginning of this module in this content is when in doubt, check it out. When in doubt, find out. When in doubt, go figure it out. So that's something that we want to make sure everybody understands because this information here is not going to, you're not going to remember everything we talk about, and it's not comprehensive to everything that can happen and every different baby and how every different baby is going to react to something that could be life-threatening. And with babies, things can go south really fast. They're such a small little creature that any disruption in their homeostasis can quickly become very severe because they don't have the ability to maintain and get back to homeostasis with the immune system and just other biological processes that are stronger and more hardy. So we don't want to be freaking out, panicking at every little thing, but if we're uncertain and we're worried about something, we need to go check it out. That's what we're there for. That's what we should be thinking. There should be no hesitance to, once you realize that you're worried or uncertain about something, contact an authority. Call 911 and talk to them and see what's going on. Get somebody out there, a paramedic, to check it out. If you're scared and you feel that panic start to set in, don't hesitate. Take advantage of those instincts that biology has given us to panic when things are serious, because you might not be able to articulate what it is that's unusual about the baby, and maybe you're not a trained medical professional, so you're not able to do the proper quote-unquote assessment to get all the exact vital signs that we're going to go over here, but something tells you that something's off. Go ahead and call for help. Don't hesitate. Now, with that being said, we're going to provide you here with some of the vital signs on some of the major things that we can observe to help us make sure we don't miss anything. Like maybe our internal alarm's not going off, and maybe there's no warning bell sounding. However, some of these vital signs are concerning and we're curious about it, so we can check them out. And then in checking them out, we'll be able to find out, are these serious and worthy of contacting the medical professionals, or is this just completely normal and I'm overreacting? So like we said, if you are in doubt and you're scared, contact 911. Reach out for medical help. Call the pediatrician's office if you have them available. Do whatever you need to do if you do feel scared and worried. However, if you're not scared and worried and you just want to make sure everything's still, flying smooth, these are going to be some signs that you can check on that will help confirm whether or not it's normal. Also, anything that we're talking about here that is outside of the ranges of normal, babies are all unique. Their biologies are all different. The environments they're in are different. The food we're giving them is different. Their genetics are different. So many different experiences when it comes to raising babies. So keep that in mind and take all this information with a grain of salt. And what we want to also help you understand is that it's a holistic thing. Sometimes it's not going to be one of these things being out of range, and that's a reason to go to the hospital because everything else seems normal. Maybe it is normal. Maybe it's not. We're not sure. Who knows? These are hypothetical situations. But what we're saying is try to take a holistic approach and look at all of these vital signs taken together to help you decide when to reach out for help, when help is even necessary, or if it's something that the baby's going to get through themselves. Because that's another thing is we don't want to over treat, medicate, take babies to hospitals where there are a lot of germs. There is risk in that by itself, although there are some virtual like teledoc services that are pretty excellent that really make it so that, like we said, and we're going to repeat again, if you're unsure, reach out to a professional. So what we're going to talk about in this module are the vital signs. We're going to talk a lot about vomit and stool, and then we're going to also talk a little bit about colic to wrap it up, because that is a common concern. And in this module regarding colic, we are not experts on colic. There's so much different information on colic, what causes it, how to soothe it. So what we're going to do is we're just going to play a video that we think is really informative to help you guys kind of check it out and form your own conclusions. And then when you're in the situation with the child, you can do your own research, because colic typically is not an emergency situation, but it is something to where the baby is experiencing some sort of distress. So we want to do whatever we can to help soothe the baby. And it's just going to be different. There's going to be different things that help different babies. So that's going to be something that's going to be a challenge for you, and something that you can work with the child's pediatrician if that's available to you. Or it could just be, waiting it out. A lot of times it does just pass with like a stage. So moving forward, one quick high impact red disclaimer here. We are not doctors. When you have any doubts, check it out, find out, figure it out by talking to a trained medical professional. This is general advice and not to be considered a substitute for professional medical advice. So let's talk about breathing rates. One of the best things or best signs that we have is babies' breathing rates. They tell us a lot. And they're also really easy to gauge. You can, lightly place your hand on their chest or the abdomen and count the breath rates. Or you can look at the baby's nose, and if you see nasal flaring, that's a serious sign. If you see chest retractions where the baby's like inhaling and it makes their ribs visible because the skin like sucks tight to their chest, that's a serious sign. Bluish skin can be a result of heart or breathing issues. And so when you're doing the breath rates and when you're looking at this, you want to make sure you use a full minute, because babies have irregular breathing where it's periodic breathing where they might stop breathing for a few seconds. So just doing it by 30 seconds and timesing it by 2 is not a sufficient way to measure breathing rate in an infant. So what you'll want to do is just use a timer on your phone or like an egg timer, set it for a minute, and then count the baby's breath rates by, like we said, put the hand lightly on the chest. Here's a chart that's going to be in the PDF attached to the course. So the different age groups are going to have different vital sign normal ranges. So with the respiratory rate, that's the main one that we're going to focus on here in this module. But we're also going to look at heart rate. However, heart rate is one of those things that we don't want to wrap too much of our judgment on, wrap it up in, or attach it to. Heart rate is really variable in infants naturally. So, but respiratory rate's pretty consistent. When a baby has a high respiratory rate, that's a sign of problems. When a baby has a low respiratory rate, that's a sign of problems. So when you have issues with respiratory rate that are going above or below these normal ranges, that is a reason to contact a physician. Respiratory rate alone is a very good and very powerful indicator that you want to rely on. Now, When we're talking about the pulse, like we said, the heart rate is extremely irregular in infants, and that's because the parasympathetic nervous system is still developing in newborns. And so we look at pulse as kind of a secondary sign. So if you see semi, like borderline high breathing rate, but also low pulse rate or high pulse rate, now that becomes a sign of concern because they're combined together, quite unusual. And when you're checking infant rates, heart rates, the best way to do it is with a stethoscope on the apical pulse, which is right below the left nipple on the chest. And what you're going to listen for is that typical lub dub, lub dub, lub dub. And one lub dub is a count. So lub dub, that's 2 beats. Or you can check it the typical way with the fingers on the wrist, maybe in an infant. But you'll be better off trying to check it out with the brachial artery, which is in the armpit. And you can do that just like you would with the fingers on the wrist. But you could do that in the armpit, or you can do it at the fold of the elbow and the pit of the elbow. You can also check them on the ankle, like right at the top of the ankle, or in the hip at the femoral artery. Those are all places where you can check the pulse rate on an infant or newborn or toddler if you need to. And again, use the timer for 1 full minute because of the irregularities that are in a baby system. Baby systems are they're new. And so they're still trying to get steady and strong. So you want to make sure you count for a full minute when you're checking that pulse rate. So here again is the chart for what's normal. That PDF is going to be in the attachments. And like we said, expect heart rate to be very variable. So if the heart rate for a period of time is out of range, that's not a great sign of concern. However, if it's out of range and the respiratory rate is borderline, or the baby's skin looks flush and clammy or sweaty, or it's looking like maybe a little bit bluish or something like that, like any of those things combined with heart rate is a sign for concern. Another really good thing that we can check with babies is going to be the temperature. So the normal range for 0 to 3 months is 96 to 99. And then 3 to 36, it goes up, it actually widens out a little bit, we should say, to 95.7 up to 99.6 becomes normal range. And temperature is one of those things where babies are going to have fevers often. When they teeth, they're going to have fevers all the time. Anytime a baby's body is fighting off stuff, fever is one of the first responses that triggers a cascade of different responses in the immune system. So fevers are normal. We don't want to fight fevers. We want fevers to happen. However, fevers can also lead to serious neural damage in babies if it goes too high. It can also be severe signs when it goes too low. So we do want to monitor the fevers. And one of the things we're going to monitor for with a high fever is a prolonged fever. So does the fever last for several days? Is it combined with the irregular breathing rate? Is it combined with an irregular pulse? Is the fever combined with diarrhea and dehydration? So again, you're looking at all of these signs coming together. So that's the reason we're giving it to you, so you have one more threshold that you can say, okay, I've got 2 unusual vital signs here, so that you can kind of help decide for yourself if everything is, copacetic and nothing to worry about, or should you be monitoring a little bit closer, doing more fever checks, more breathing rate checks, so that you can just monitor it and stay on top of it in case it does become more serious. Or does the baby work through it and battle it out? Because these babies will battle it out. Quite often they're very resilient, considering all the things that they're having to fight in this new world that they're in. However, they are also fragile, and we don't want to lose sight of that. I know it is kind of a trope to believe, babies are so tough, really, like they're amazing. They fall without breaking bones, and they can bounce back from anything, it seems like. However, things can quickly become tragic. So, not on our watch, though. We're going to make sure, when in doubt, we're going to check it out, find out. We're going to contact someone and just really make sure we're always doing the right thing for the baby. So that's some of the vital signs that we can look at. And some more of them that are a little bit more obvious is things like skin color. So bluer skin is a serious sign. It either means a baby's got a more serious like heart defect, like cyanosis, or it could be a blockage. So they're bluish skin, and then sometimes with the bluish skin, it'll kind of come and go. So any time that it comes and goes, you still want to contact a physician about that, because that could be a sign of an underlying like serious physical defect. But if it's blue and it's baby's getting bluer and bluer, there's a blockage. There's an emergency situation. You need to try to clear the blockage using what you've learned in CPR and first aid, or you need to contact 911 and get an emergency responder to come help you out, just in case you have more troubles than you can handle. So bluer skin is always serious. Now, another symptom is if the baby becomes lethargic. So if the fever is high, but the baby's breathing rate's normal and everything else is normal, but the baby starts to become lethargic, okay, that becomes a serious issue. Or the temperature's low, and the baby starts to become lethargic. Again, it becomes a serious issue. Like we said, all of these things are to be looked at in a totality. So if there's multiple vital signs that are unusual, then that means that we need to act. And like we said earlier, without hesitation. Use this chart, refer to this chart to help look at what you need to be checking out, but don't hesitate to call for help. It's quite all right. The parents will be glad you did it. Everyone will be glad you did it. So don't be afraid to be the squeaky wheel. That's something we really want to make sure everybody understands here.
Time. We would like to take just a few moments to talk to you about infant distress. Infant distress means your baby is having difficulties.
Summing up everything we've covered so far.
Knowing what to look for will help you know if your baby is in distress. Your baby may have breathing problems, such as retractions, grunting, and apnea. Retractions are unusual breathing movements. With each breath, your baby's chest muscles pull in the skin around the bones. Grunting is a noisy breathing sound. Your baby may grunt to keep air in the lungs. Grunting may sound like snoring or singing. Apnea is a condition in which your baby pauses breathing for 15 to 20 seconds. Then continues breathing. You may notice changes in your baby's skin. Two common findings are conditions known as cyanosis and jaundice. Cyanosis is a blue skin color. You can usually see it around your baby's lips, chest, and stomach. This blue color means that the oxygen level in the blood may be too low. Cyanosis may mean there is a problem with the baby's lungs or heart. Jaundice is an overall yellow skin color. It happens when a substance called bilirubin builds up in the blood. Most babies have some jaundice that appears more than 24 hours after birth. If left untreated, severe or long-lasting jaundice may cause brain damage. It's important to check your baby for these signs of distress. Immediately contact a member of your healthcare team if you notice any of these warning signs.
All right, so now let's talk about poop. We're going to look at a few different things when it comes to poop, but overall, we just want to make sure everybody understands that poop is a very excellent source of data on the human body. As adults, it's a great source of information to make sure everything inside is going healthy all throughout childhood. You can really learn a lot about your children's stool and just making sure that it's normal. And so what is normal? With infants and newborns, we're going to talk about their consistency. So it's like a smooth, soft consistency, nothing hard. Also, we don't want too much diarrhea for too long, although some poops are going to be runny, but we don't want consistently runny poop. Also, we're going to look at the different colors. Baby's poop has a wide variety of colors. It comes out black when they're newborns. That's the meconium. And then it will change over the course of the next few weeks. And breastfed babies are going to have different colors than formula-fed babies, but in general, you can expect to have a really wide range of colors when it comes to poop. However, there are some colors that are more serious and cause for consulting the physician, and that's if it's red. So if you see blood in it, that's an emergency situation. And then if it's chalky, white, or gray, that's also something that you want to contact the medical professionals about. Another thing to consider with poop is frequency. So, in adults, you want to be like somewhat regular, and if somebody goes off their regular schedule, that might be a little bit of sign of concern because it causes distress. But 9 out of 10 times, it's really not a big deal, and so that's the same as it is for children. It can be irregular; it's really not a big deal. As long as the consistency is good. The consistency meaning like how solid or how soft the poop is, that's going to be more important. And to make sure that the child is, when they're having stools, not experiencing too much distress. Some grunting and stuff is normal, but there's a line to where it's normal to where it's unusually painful or distressing for the infant. So you're going to want to just be able to make sure you're observing that and being aware of that as a potential issue. So now we're going to watch some videos on poop. We're going to watch several of them because it really is so important and it's such a vital source of information. And it's like one of the best, it's like the canary in the gold mine for babies. It lets us know what's going on before any other outward manifestations happen. So we're going to do a few videos on baby poop because it's a common sign of distress that we want everyone to be aware of.
Hello everyone, I'm Dr. Spurti Kapate, pediatrician and neonatologist at Cloud9 Hospital, Electronic City. So babies can pass motion. They can be as frequent as 10 to 15 times a day. It can be once in a week also. Both variations are normal. And the same variation in terms of color is also normal. Like the babies can have yellow stools, green stools, or brown stools. So these colors are normal. When do you worry is when your baby is either passing white, pale, chalky grayish color stools, or there is obviously blood in stools. So these are the two scenarios where you should immediately meet your pediatrician. But apart from these two, any other color in the baby is normal, and it is not necessary that the baby will have the same color every day. There can be slight variations here and there. Maybe 5 days baby passes yellow stool and then one day has a green stool or a brown stool. So that's absolutely normal. There's nothing to worry. Hello everyone, I'm Dr. Spurti Kapate.
So another potential issue is diarrhea and dehydration. So we want to also look at dehydration when it comes to the urine in the diapers. So, be aware and notice if there's suddenly a lot less urine in the diaper. There's many signs of dehydration, we should say there's many sources of dehydration, and none of them are good. So we want to make sure this babies are staying hydrated because that is a key condition of health and life, is to maintain hydration. And dehydration can lead to organ failure. It can lead to death, and it can lead to if it doesn't lead to death, it can cause long-term disruptions in their organ functioning. So dehydration is actually really serious. So we want to make sure we're monitoring the urine in the diapers and looking at a few other signs that are going to be mentioned in this video here.
To have soft poop. It's normal for them to poop 8 times a day. And it's even normal for poop to shoot out of their diaper and end up on their back. So how can you tell if they have diarrhea? Even for us doctors, it can be tricky. If your baby suddenly starts pooping a lot more and her stool is more watery than usual, she's probably got the runs. Diarrhea can be caused by a change in diet, antibiotics, a food allergy, or a stomach virus. Here are 3 steps to take if your baby has diarrhea. Give plenty of liquids. If you're breastfeeding, keep it up. It may help your baby recover faster. Your pediatrician may also recommend a pediatric electrolyte solution to increase your baby's fluid intake. You also want to feed your baby normally. If she eats solids, she can eat her normal diet, although you might want to cut back a bit on fruit and avoid juice. Yogurt with live cultures may speed her recovery. Lastly, watch for dehydration. This is the biggest risk because babies can lose a lot of fluid quickly. If she's crying without tears, having fewer wet diapers, her skin seems different, or the soft spot on her head is sunken, call your doctor right away.
Okay, and like she said, so there's a few key things that we want to look at that are for dehydration symptoms. And if you experience those, call the doctor right away. Dehydration seems minor in adults because we're so big and our systems can manage it. But in infants, it can become quite serious, quite fast. So that if you don't take care of it in this evening, by overnight, it could become a very, very serious, even critical issue. So we want to make sure that we understand that hydration, dehydration are serious symptoms that we want to talk to medical professionals about. So to wrap it up with poop, we're going to watch one more little video here. But mainly, we just want to pay attention. And like we say, when in doubt, find out.
After all these weeks of changing diapers, you'd think you'd be a pro when it comes to poop. But it's time to take a deeper dive in your baby's diaper and get the new scoop on poop. Remember way back in your baby's newborn days when every day seemed to bring a new record number of poops? A poop with every feed, maybe more. That prolific pooping was a sign that all was right in your baby's world and in her diaper. Maybe your baby's still filling his diaper at an impressive pace, especially if he's exclusively breastfed. Or maybe his pooping pattern has slowed from that brisk early pace. He's pooping just a few times a day instead of 8 times, or maybe he's only pooping once a day, or even once every other day. Maybe he'll go 5 days without going, and then poop twice in the same morning. Happily, there's no need to keep count of those dirty diapers anymore, even if your baby's breastfed. All you'll need to track now is your baby. If she's growing and thriving, don't sweat the poop numbers. Concerned about constipation, exclusively breastfed infants are rarely constipated, and even at this stage, their poops, no matter how frequently or infrequently they arrive, are likely to be very soft, sometimes even watery. Formula-fed babies can get clogged up, but again, frequency won't clue you in. Consistency will. If those poops are soft and are delivered without a struggle, even if days pass between poops, your little pooper isn't constipated. No need to jump to constipation conclusions either if baby grunts, groans, and strains when he poops. That's standard pooping practice for babies this age, even when passing soft poop. If your baby's poops are firmly formed before solids have been introduced or are passed in hard pellets, she may be constipated. Check with the pediatrician to see if a change in formula might help get things moving, or a daily dose of baby probiotics. Another way to help move things along, try bicycling baby's legs at every diaper change, what I like to call poop aerobics. Is all that poop and pee leaving its mark on your baby's sweet bottom? The bottom line on diaper rash is it isn't pretty or comfortable, but it comes with the diaper wearing territory. That pesky red rash is triggered by a combination of too much moisture, too little air, a whole lot of friction, and irritants like pee, poop, wipes, and detergents, which pretty much sums up what your baby's bottom is exposed to around the clock. A change in diapers to a different brand or from disposable to cloth, or to cloth that's been washed in a gentler soap, may help, as can more frequent diaper changes. When cleaning that baby bum, use products that are gentle and unscented. Try water wipes, cotton balls with warm water, or even a soft washcloth. Then give that bare bum some airtime. In a rush, blow on or fan it to make sure that sweet bottom is completely dry before spreading a thick, protective layer of ointment or cream to prevent urine and poop from reaching his skin and irritating the rash further. If the rash doesn't clear up or at least start improving in a day or two, or if it gets redder, check in with the doctor, who may prescribe a topical
Antifungal is what she was going to say before we cut her off. So enough about poop. Can we please just talk about some vomit? And yes, we can. So with vomit, there's going to be mainly, we're going to look at the frequency. So if it's continuous vomiting, that's going to be an issue that we want to check out. It could be a sign of concussion or other serious problems, but we'll want to contact a physician if the vomiting is continuous or if it's bloody. So if you see any red in the vomit, that's also a sign to contact emergency services. Or if it's green with a swollen abdomen, that could be a sign of bile feeding back up into and spitting out. So that's serious enough that we're going to go ahead and watch a video on that as well. And then that will almost wrap up the course. So let's go ahead.
With the digestive system, so they may not be able to poo properly. So vast majority of babies who are breastfeeding may not poo every day. So some of them poo every few days. That's because the breastfeeding baby will absorb most of what is being fed.
Right.
And there'll be very little residue to be expelled and pooed out. So there's something something that parents shouldn't worry too much about, as long as the tummy is not distended. A child who's got a distended tummy, who's starting to vomit, especially the vomit is green, you need to worry about an obstruction. So those are the situations when you need to visit a surgeon or a pediatrician to rule out any problems, which is a structural problem or functional problem when the bottom doesn't open up, or there's a problem with expelling feces.
So a bloated tummy and green vomit.
That's
and
right.
The green being bile.
Green is bile vomit.
Right.
Yes.
Okay.
The bile is being produced into the intestine from the liver.
Yeah.
Just beyond the stomach.
Right.
The stomach is the first part of your intestine in the tummy.
Yeah.
You swallow through your esophagus and it goes to your stomach. And once the food passes the stomach, it reaches an area called the duodenum. That's where the bile enters the intestine. So if you got obstruction further downstream, then when there's your food can't go beyond that, you start vomiting.
Right.
And you vomit the bilus that's
Right.
been produced, and that goes to your stomach and you expel it through your mouth.
Okay.
And once you get bile vomit, it's indicative of an obstruction in your intestine. If you have a child who's vomiting bile, then you need to take the child to a hospital or see a doctor, and they will assess whether this is an obstruction causing the bile vomiting. So one of the things that we look out for is whether there's a functional problem where the bottom doesn't open up, or if there is a structural problem where there is a blockage in your intestine. So all that will be investigated. So something that's related to the bottom end is where the nerve is not relaxing the muscle of the intestine very well, whereby the child is not expelling, or the bottom is not made properly. So the bottom may be a small opening, or the bottom may be in an abnormal position, whereby the child is not able to poo out.
This is investigated in the hospital by yourself or by a doctor.
If the child has got an abnormal position anus,
Yep.
or abnormal size anus, or the bottom is not opening up adequately to allow the poo to come out, then we will examine the child to look out for what the problem is, and also probably do some investigations, as in x-rays investigation or ultrasound scan investigations, to look out for what the problem is.
And should that problem arise, what is the typical treatment that is required?
So there are a few different conditions.
Yep.
If the condition is a simple functional problem where the child is not pooing properly, we might need some laxatives. If there is some other issues with the position of the anus, that will require surgery. And that will depend on what the condition is.
Okay. All right, understand. But basically, so the key message is, should your child be having a distended tummy, a bloated tummy, and as soon as they start vomiting a green color kind of vomit, do not delay, go see a doctor, go to the hospital.
That's right, yes. So
Right.
they set problems with the digestive
So,
system,
you know,
so
don't
they might not
delay
be able
get
to
to the
poo properly.
hospital for
So
bloated
vast
tummy,
majority of
big vomit,
babies
all those other things
who
that
are
we talked
breastfeeding
about,
may not poo every
high
day.
breathing
So some of them
rate,
poo every
bluishness,
few days. That's because the
the
breastfeeding
blood in the
baby
stool,
will absorb most of what is being fed.
there's just so
Right.
many
And there'll
things that we
be
cover
very
in
little
this, so
residue
it's
to be
really
expelled
remember, but
and
when
pooed
in
out.
doubt, contact a
So
medical
there's something
professional.
something that parents should
That
know.
being said, we're going to repeat, we are not doctors. When you have any doubts, check it out. Find out, go figure it out by talking to a trained medical professional. This is general advice and not to be considered a substitute for professional medical advice. Now, with that being said, even doctors make mistakes. You are there with that child. You know that child better than anyone. You're spending that time building that bond, and that bond is serious. It goes beyond words, really. So if your internal senses tell you that there's something wrong, trust your instincts and don't be afraid to be a squeaky wheel. You are there to be the advocate and the voice for that baby. So make sure you're loud and proud when you're protecting and looking out for the little ones. And remember, when in doubt, you know, find out, check it out, look it up, do whatever you got to do to figure it out. Because, you know, just letting doubt happen and being wishy-washy and not doing anything can lead to fatal mistakes. So it's just not acceptable. So when you're with newborns and babies, you've got to contact the doctor if you have doubts. Follow these guidelines. These are excellent little thresholds to help you, be sure that everything's okay if you have a little bit of doubt. But if you're seriously concerned, check it out. Don't hesitate. All right, so now we're going to do one more bit about colic.
We expect babies to cry, but does your baby cry for prolonged periods of time for no apparent reason? If your baby is about 3 weeks old and cries intensively that lasts for several hours in the late afternoon or evening, he might have colic. Colic tends to peak when a baby is 6 weeks old and then improves significantly between 3 and 4 months. Your baby's face may turn red, pull his legs up while crying, clench his fists, and may arch his back. Although there is no cure for colic, it will go away when your baby is 3 to 4 months old. There are some methods to ease the discomfort caused by colic. 1. Always burp your baby well after feeding. 2. You can prevent your baby from swallowing air by sitting or holding him upright during feeds. 3. Hold your baby and gently place him over your shoulder. Other methods to calm your baby include cuddling. Baby wearing or carrying gives your baby a sense of security and physical closeness. Swaddling also gives a sense of security and warmth to your baby. Lullabies or nature sounds usually work. You can experiment with different kinds of soothing music. A change of environment works wonders at times. Take your baby for a walk or a car ride. Consult a pediatrician if you are concerned about the intense crying for no apparent reason or if colic persists. Take note of the crying duration, intensity, pattern, and accompanying symptoms if any. It will help to rule out any underlying medical condition that could trigger the cry.